The Spanish flu, also known as the 1918 flu, was an unusually deadly influenza pandemic. Lasting from January 1918 to December 1920, it infected 500 million people, about a quarter of the world's population at the time. The death toll is estimated to have been anywhere from 17 million to 50 million, and possibly as high as 100 million, making it one of the deadliest epidemics in human history. Most influenza outbreaks disproportionately kill the very young and the very old, with a higher survival rate for those in between, but the Spanish flu pandemic resulted in a higher than expected mortality rate for young adults. Malnourishment, overcrowded medical camps and hospitals, and poor hygiene promoted bacterial superinfection. A major World War I UK troop hospital camp in France has been theorized by researchers as being at the center of the Spanish flu. A significant virus, harbored in birds, mutated and then migrated to pigs kept near the front of the camp. The overcrowded camp and hospital was an ideal site for the spreading of a respiratory virus. The hospital treated thousands of victims and 100,000 soldiers passed through the camp every day. To maintain morale, World War I censors minimized early reports of illness and mortality in Germany, the United Kingdom, France, and the United States. Newspapers were free to report the epidemic's effects in neutral Spain, and these stories created a false impression of Spain as especially hard hit. This gave rise to the pandemic's nickname, Spanish flu. When an infected person sneezes or coughs, more than 500,000 virus particles can spread to those nearby. The close quarters and massive troop movements of World War I hastened the pandemic, and probably both increased transmission and mutation. The war may also have increased the lethality of the virus. Some speculate the soldiers' immune systems were weakened by malnourishment, as well as the stresses of combat and chemical attacks, increasing their susceptibility. A large factor in the worldwide occurrence of this flu was increased travel. Modern transportation systems made it easier for soldiers, sailors, and civilian travelers to spread the disease. Even in areas where mortality was low, so many adults were incapacitated that much of everyday life was hampered. Some communities closed all stores or required customers to leave orders outside. There were reports that healthcare workers could not tend the sick nor the gravediggers bury the dead because they too were ill. The second wave of the 1918 pandemic was much deadlier than the first. The first wave had resembled typical flu epidemics. Those most at risk were the sick and elderly, while younger, healthier people recovered easily. By August, when the second wave began in France, Sierra Leone, and the United States, the virus had mutated to a much deadlier form. October 1918 was the deadliest month of the whole pandemic. After the lethal second wave struck in late 1918, new cases dropped abruptly, almost to nothing after the peak in the second wave. One explanation for the rapid decline in the lethality of the disease is that doctors became more effective in prevention and treatment of the pneumonia that developed after the victims had contracted the virus. Despite the high morbidity and mortality rates that resulted from the epidemic, the Spanish flu began to fade from public awareness over the decades until the arrival of news about bird flu and other pandemics in the 1990s and 2000s. This has led some historians to label the Spanish flu a forgotten pandemic.